How does glucose work in children with type 1 diabetes? Imagine your body is like a busy city, and glucose is the fuel that keeps everything running smoothly. When children eat foods rich in carbohydrates like bread, pasta, or fruits, their bodies break down these foods into glucose, which then enters the bloodstream. Normally, the pancreas releases insulin, a hormone that acts like a key, unlocking the doors of the body's cells so glucose can enter and be used for energy. This process helps keep blood sugar levels balanced. In children with type 1 diabetes, their pancreas produces little or no insulin because the immune system mistakenly attacks the insulin-producing cells. Without enough insulin, glucose can't get into the cells. Instead, it builds up in the blood, leading to high blood sugar levels, a condition called hyperglycemia. This can cause symptoms like increased thirst, frequent urination, fatigue, and hunger. Managing glucose in children with type 1 diabetes involves giving insulin through injections or a pump to replace what their body can't produce. Insulin helps move glucose from the blood into the cells, providing energy for growth, play, and learning. Because every child's body responds differently, insulin doses need to be carefully adjusted based on what they eat, how active they are, and their blood sugar levels. Eating the right amount of carbohydrates is important, but it can be tricky because different foods affect blood sugar differently. For example, sugary snacks can cause quick spikes, while fiber-rich foods may slow absorption. Children with type 1 diabetes need to match their insulin doses to their carbohydrate intake to prevent blood sugar from going too high after meals or too low if they take too much insulin. Using technology like continuous glucose monitoring devices helps children and their caregivers see real-time blood sugar levels. These devices provide instant feedback, making it easier to decide when to take insulin or eat a snack. Physical activity also influences blood sugar levels. Exercise can lower blood sugar by making the body more sensitive to insulin, but intense activity might sometimes cause blood sugar to rise temporarily. That's why children need to check their levels before, during, and after activity and have quick sources of sugar ready in case their blood sugar drops too low. In summary, glucose in children with type 1 diabetes depends on external insulin to help it enter the body's cells. Proper management involves balancing insulin doses with food intake and activity, using monitoring tools, and working closely with healthcare providers. This careful approach helps children grow, stay healthy, and enjoy their daily activities while preventing long-term complications. Always remember, each child's experience is unique, so personalized medical advice is essential for the best care.